This is a CGSN podcast. My name is McCausland. I'm a nephrologist and clinical researcher from Brigham and Women's Hospital in Boston. In this podcast, we're going to briefly summarize the main findings from our paper exploring the effect of Finerenone on eGFR slope across different baseline levels of albuminuria and eGFR in the FINEARTS-HF trial. Briefly, FINEARTS-HF was a large randomized controlled trial testing Finerenone, a non-steroidal MRA, against placebo among patients with heart failure and a left ventricular ejection fraction of 40% or greater. The primary results showed that Finerenone reduced the composite outcome of heart failure events and cardiovascular death by 16%. In pre-specified secondary analyses of FINEARTS-HF, we previously reported that Finerenone did not modify long-term clinical kidney outcomes or eGFR slope compared with placebo. However, the population of FINEARTS-HF was at relatively low risk of kidney disease progression, and our results were in contrast to the beneficial effects of Finerenone to reduce kidney outcomes among patients with type 2 diabetes, established chronic kidney disease, and albuminuria. Therefore, in the present analyses, we hypothesized that the effect of Finerenone on eGFR slope would differ according to the baseline eGFR and albuminuria. So among 5,797 participants with available data, the mean baseline eGFR was 62 mils per minute, and the median UACR was 18 milligrams per gram. 10% of patients had a UACR of 300 milligrams per gram or greater. The effects of Finerenone on eGFR slope were similar across baseline eGFR categories, but although the p-interaction was 0.09, Finerenone appeared to slow the decline in eGFR slope more than placebo among those with UACR of 300 milligrams per gram or greater. The difference for the subgroup was 1.2 mils per minute per year in favor of the Finerenone group. In summary, among patients with heart failure and macroalbuminuria, a subgroup of patients at higher risk of kidney disease progression, Finerenone was associated with a slower decline in chronic eGFR slope to a clinically relevant greater extent than placebo.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.